I'm Serena. I'm a Hong Kong U medical student and I'm joined with Dr. Ji, the Vice Director of the Peking University Clinical Research Institution in Shenzhen. Welcome. Can you tell us a bit more about what you usually do in your daily work?
Okay, in my daily work, it depends on my role. I do some work for the clinical research quality control, and also do some research ethical committee review work.
Right. Are these ethical committees a new development in China, or have they been in place for a long time?
Early back in 1995, I think, that time, almost 30 years ago, our government health commission and the China FDA tried to meet the requirement for the global trial. So we set up the research ethical committee in hospital. But in recent years, we have changed a lot. Our Shenzhen Research Ethical Committee was established in 2017.
That's quite recent.
Yeah, we try to speed up the multiple centered trials for single RB review. But it turned out because we don't have so many multiple trial
Right.
running, so we do lots of training and for the policy making and for the research ethical committee development for the institutional, like not only for hospital, for the university, for research institute, even for some company. They
Right.
have because they get more involvement for the medical research.
I am quite surprised when you mentioned that there is not a lot of trials going on in Shenzhen, because I feel like in recent years the medical development in Shenzhen is going really, really rapidly. So, do you guys have a lot of work, a lot of protocols to review in the research field in Shenzhen?
Okay, let me clarify.
Right,
We
right.
do have more and more clinical research, but it's not the multiple centered trials as we
I see.
expected in the
Right.
beginning. We have that part. I think the number is decreased for the multiple centered trial. For the number of the clinical research, is the number or the complexity has increased greatly.
Right. So, among all these research trials that you personally may have reviewed or you are involved in reviewing, what do you think are they usually ethically compliant? Do you think they already reached quite a high ethical standard and you don't really have to do a lot of amendments to the protocols? What does it look like?
I think it's changed a lot. In 2010, I first involved for Peking University Human Research Protection Program. When I look at that time for our RB, we find lots of protocols don't meet the ethical requirements. But now, because of the researcher has learned a lot, they have got more experience. Also, we got more supportive structure there. We provided the protocol development consultant. Also, we have the scientific review procedure now. So it's made them to, currently, I think they improved a lot. So our review type has changed. Before we do more for the meeting to approve the project, but currently 80% for the expedited review or even exemption review type has we have now.
So you're doing very comprehensive work. You do training, you do meetings, and you also do review and ethics committees. That's a lot of work. What is your motivation? You mentioned that you joined the Human Protection project in Peking University. What motivated you to be interested in that?
I think it's like passive because in my role I worked in as a quality control staff, so I just passively joined the program. But it turned out I had developed my interest in research ethics. I felt it's really worth to advocate.
Do you think it's rewarding when you see, research getting better and better and more ethical over the years?
Yeah, definitely. It's changed a lot from the quality control perspective, I felt so as well. Because of the ethics involved, they will consider the like vulnerable population, whether they should be included. Also for some design randomized trial, whether it should be randomized or not, that type of thing. I think it's also for the risk control. I felt we have insurance for the clinical trial to protect the patient or for the informed consent. All this type of thing, I think, is from ethical perspective to help we do the clinical research properly, ethically.
Right. And do you think researchers in mainland China are more and more aware of research ethics, and are they more receptive to the idea?
Yeah, it's obviously. I think it's researcher or from the government. In China, from the national government, they pay much attention to strengthen research ethics, develop the policy, and have the oversight mechanism.
Yeah, I know some people may think that, having a lot of ethical guidelines in place would kind of, stop innovation or advancement from going on. Do you agree with that view at all?
I think generally speaking, it's made the clinical research better. But for some, of course, there are some cases to show it's like not help for the innovation. But we try to keep balance, to make innovation and to follow the ethical standards.
Right. When you talk about examples, the first thing that popped into mind is definitely He Jiankui. What do research ethics people in China think about him?
It's a crazy thing. I think I don't know am I right, but I think he's not qualified researcher from the very beginning. He's not from medical background, but he did this medical research. Even from the paperwork he published, he got the informed consent, he got the IRB approval, but that institution gives the IRB approval is not qualified at all.
Right.
Also, I think from the technique thing as well, so all can't be convinced by ethical principles. It's a wrong thing. He's a bad example.
He is a bad example indeed, and that's what you guys are trying to prevent from happening again.
Yeah.
Right. I understand that you have been a clinical researcher for over 20 years, and then now you are more in the administrative part of ethics. What do you think did your perspective change when you approach a research, as a researcher or as an administrator for ethical compliance?
I think more as an administrator, I felt now hope less research but better research. As a learner 20 years ago, we thought so lucky to have a chance to do the clinical research. So we try to encourage everybody to join the clinical research work. But when I looked back now, I felt so many meaningless research, so redundant research we shouldn't do. If it's not well designed, if it can't be well implemented, it shouldn't start. So that's why I think we need the clinical research ecosystem, get the ethical involved. Also, we need quality control from the design from beginning to the end, whole life cycle of the clinical research project.
Right.
Not just chasing for the numbers. We need the good quality research to provide real evidence for clinical care.
I agree. I think the development of research ethics in China or even in the whole world has changed a lot from when it first started as a response to, horrific, bad examples to now just being regulations in place. And I think the most recent amendment in the Declaration of Helsinki also, brought in more current issues such as the protection of the environment, less pollution, as well as community involvement. Do you feel like these are concepts that you personally or China is going to incorporate into research ethics. So, for example, more community involvement, or protection of animals, or protection of the whole ecosystem as a whole. Are these new directions you're going for?
Definitely. I think we follow the develop health thinking for the, as you mentioned, for the public engagement and for the reduce the research waste, and also for the environmental sustainability. Because of the AI, this type of research now, so we need to take care of more broadly, not only for the, I think it's a big change from the beginning. We start doing clinical research for the clinical trial, so we focus on the individual subjects' rights. But now with AI, with many advanced medical technology, we need to pay attention to the public good. I think data ethics, that's different principles for the collective interest, not only for individual subject. So I think that's a big change, and also a challenge for our routine work. When we got like more than half for clinical research just based on the data usage, secondary usage. How can we do the review efficiently or good quality? We have the challenge as well.
Right, that's very well said. I've always wondered whether you personally experience any difference in values between, the Chinese values as well as the more westernized values on what is ethical in a research. You talked about the collective community, and I feel like that's something that Chinese people value a lot, the collectivism and the whole community involvement. But in the Western society, usually people are more individualized. Do you feel like that plays a part in your work as a reviewer for research ethics?
To tell you the truth, I felt in Western it's more transparent, no matter for the review process or even get the more public people engaged. I visited the UK 2019. I saw their policy. They required no less than 1/3 lay person should join the RB.
Right.
For us, currently we have a requirement to have at least one lay person or outside the institution as a RD member. And I felt it's not enough. Yeah. Also for the transparency, when I was in UK, I can read everything online,
right.
Even their review meeting minutes. But in China, I think, I don't know, it's everything protect well.
Okay.
But it's not good. In some way, it's good for institution, probably protect for the project, protect for the researcher. But I think it's not good for sharing.
That's true.
That's what I felt.
Okay, so is that something you're trying to work on?
Yeah, another, I think more in US or in UK, I observed some research ethical committee meeting,
right.
As an observer. I felt they have more professional people do the whole work.
Right. So more transparent, more public engagement, but also it's more professional in terms of how they do things.
Yes.
But you feel like China is also on the way to that.
Yeah, it's changed a lot. There are more and more people do the research ethical review properly now.
I am very happy to hear that, because I know research in China is booming. Everything is going great, but I am very assured to know that there are people working hard to make sure that these research is also up to ethical standards. Yeah. So future directions, gonna continue on your work as a administrator in research ethics in China?
Yeah, we have to meet the requirements of the need in reality for with the pattern of the research change. So we need to catch up for the specific guidelines, worksheet, SOPs for the medical AI, for the secondary use of data, for the medical innovation, cell therapy, gene therapy, this type of thing. We are still learning to do it better.
Right. And just before we wrap up, because I'm a medical student myself, I've always believed in the importance of learning about the importance of research ethics as a student. So even before we actually get into research, now that we understand that it's something that is very significant and we kind of understand the basics of it, we can get into the research field with much more quality controls. Do you think that is important, educating from students when we are students?
I think it's very important to have the right value in the beginning, because it's in medical care system of the context. It's very special thing. Ethical is more sensitive. It's more important. But currently, I think we started the course too early, always at grade 1 or 2. At that time, students had very high pressure for, they have lots of tests or lots of knowledge to learn. So on the other hand, they don't have the real experience to communicate with patients, so they don't have the clue what will happen in real clinical practice. I think it's not only it's important for the medical school, also for the later stage when they start their work. I think they need more support for the clinical part.
I absolutely agree with you. When I did my master's in bioethics last year, I didn't have a lot of clinical experience, but some of my classmates are actual clinical researchers, and our perspective definitely is very different. Mine is very ideological, it's in theory it is this, in theory it's that, it should be like this. But when you have some more experience and actual work experience, I feel like the way ethics is put in practice might be different.
True. We have some course in main campus in Peking University for the clinical research ethics. We got lots of students as a medical doctor. They always have lots of real problems or real questions. I think it's easy to start a conversation or discussion in our course.
Right.
We have lots of cases. If we do for the undergraduate, it's really hard, because they always have more task or work to do. They don't really listen to the course.
I love the medical school in Peking University. I visited a couple of years ago. I think it's great. The whole curriculum is designed very well, and the people there are very nice.
Welcome to come to Shenzhen.
I will remember that course you mentioned, and maybe after a couple of years I graduate, and then I will see if I can join. And
every spring and every spring semester, and for the autumn semester we have start the course.
Okay.
Yeah, it's
great.
popular.
Yeah. Thank you, Dr. Ji, for your time today.
Pleasure.
It was a great interview.